Hi, my name is Merce Alpha. I'll be going over my notes regarding the nursing diagnosis. This video will have other parts that are continued in other videos, so make sure to review my channel if you want to expand on this knowledge. And don't forget to follow and leave a like to help grow this channel. And most importantly, I want to thank you guys so far, the ones that have followed, liked my video, and shown so much support. I really appreciate it, okay? So, in this video, we'll cover how to write nursing diagnosis statements and examples, right? So it's a good thing we see the example so that we know what to kind of tailor it to, right? I'm going to try to do my best. If you have questions and concerns, you could always leave it at the bottom of the video, and I will try my best to get to those questions and those concerns and answer it for you, okay? So let's get started. So the first one we're going to go over is called a one-part nursing diagnosis statement, right? So a little bit about that. So promotion of health nursing diagnosis are generally written as one sentence statement because related factors are always the same. Related factors can be used to improve the chosen diagnosis, such as making the person more motivated to improve their health, right? So remember that. And then we have syndromes. Syndromes don't have any related causes. So remember that part as well. It's going to be important because we're building on that as this teaching continues, okay? So some examples of a nursing diagnosis statement with one part, right? Remember that this is just a one-part nursing diagnosis, right? So there are different parts. We'll go over those, but for this one, it's just one part. So this example is an example of a one part. So it would read as readiness for enhanced coping. That's it. That would be a one-part nursing diagnosis statement. Another example would be rape trauma syndrome. One-part nursing diagnosis, right? Statement. That's it. Okay? So now let's cover what a two-part nursing diagnosis statement entails, okay? A little bit about it. Risk nursing diagnosis and possible nursing diagnosis have two parts. The diagnostic name, right? And the reason why a risk nursing diagnosis or the presence of risk factors is true. There can't be a third part for risk or possible explanation because there's no signs or symptoms included in this, okay? So this is a two-part, right? This is a two-part nursing diagnosis statement. So some of the examples of a nursing diagnostic statement with two parts would be such as risk for infection as evidenced by weakened immune response. So you saw that we had the diagnosis, risk for infection, and then we had the second part as evidenced by, and then what our evidence was, which was weakened immune system response. Another example would be risk for injury, which would be the diagnosis, as evidenced by what is the evidence on stable hemodynamic profile. So that would be a two-part nursing diagnosis statement, right? So now there's a third one, which is known as a three-part nursing diagnosis statement, right? So little information about that. There are actually three parts to an actual or problem-focused nursing diagnosis, and that includes the diagnostic label, right? The contributing cause, which is an example would be related to, and the signs and symptoms as shown by or as whatever you collected would be in that as shown by. The three part of a nurse diagnosis statements are the problem, the cause, and the signs and symptoms, also known as PES, right? So that format is called PES format. Some examples of a nursing diagnosis statement with three parts are acute pain related to tissue insomnia as evidenced by statement of I feel severe pain on my chest. So the diagnostic label of acute pain related to the tissue insomnia, as evidenced by statement of I feel severe pain on my chest. So that there was 3 parts to that, right? So those 3 datas is how you got that. That's how you got that diagnosis, right? So you had the diagnostic, what is it related by, and what's the evidence. So once again, guys, I want to thank you for watching. Make sure to check out my other videos that expand on this information. Don't forget to like and follow. Let's grow this channel, guys. You want to make sure you listen to the other videos, especially with something like this. I go over the nursing diagnosis, right, for different classes, and those nurses diagnoses are called NANDA, right, diagnosis, and nurses use that, right, to help us figure out what's going on, to also help other medical staff kind of understand what are we doing, to help this patient. How can they build? How can they expand? Doctors sometimes look at that and they're like, I like that. That's a good one. I'm going to go off of that, right? Build on that. So give the opportunity for growth. So I want to thank you guys again. I look forward to seeing your likes, your comments, and your follow. Thank you so much. I really appreciate it.